teach about the how to give the bed bath. Okay, so you have any idea about bed bath? The bath, if we are giving bath when the patient is confined on the bed. Okay, bath given when the patient is confined on the bed, or the patient, those who are not able to physically and mentally. Okay, so that patient will give the bed bath. Okay, so what are the purpose of giving bed bath? You know that the patient will have to induce the sleep, to clean, give the personal hygiene to the patient. Okay, then to prevent the infections. Okay, then reduce the pressure sore. It will give a refreshed feeling to the patient. It give the comfort to the patients. Okay, to prevent the self concept. It will improve the self concept of the patients. Okay, then regulate the body temperature. Okay, so there are many purposes there. So in the theory part you can see in the theory. Okay, so now before giving a bed bath, we have to keep all the articles ready. Okay, so the articles needed for the bed bath is the basin, one basin, and then we need two jugs. One jug for the hot water, one jug to take the cold water. Then we need a small Macintosh and a towel to protect the pillow. Okay, then long Macintosh. Okay, long Macintosh, one long Macintosh and a bath blanket. Okay, this is a bath blanket to protect the bed from the soiling. Okay, next thing we need a two sponge cloth. Okay, two sponge cloth, one to apply the soap and one clean the so remove the soap. Okay, then this is towel. There are two towel is there. One towel is used for protect the patient. Okay, and one towel to dry the patients. Okay, then soap with the soap dish. Okay, then gloves. It's a clean gloves, not a sterile gloves. We need a clean gloves. If you want to wear, that is not a must. We can give our hand the bare gloves, bare hand itself. Okay, so next kidney tray to discard the wastage. Then we have to keep the oil, so powder, okay, spirit, to give the backer to the patients. Okay, so before all the procedure, you know that before giving a bath, we have to explain the procedure to the patient. If patient is conscious, okay, if patient is conscious, we have to explain it. Okay, if patient is unconscious, we can give, even we'll give a bath to the unconscious patient also. If a patient is unconscious, we cannot explain. We have to tell to the relatives about the we are going to give a bath to the patient. Okay, kindly cooperate with us like this. If patient is conscious, we have to say that I'm going to give a bath to the bath. So kindly cooperate with me. You have to get a you have to explain it. Okay, then we have to provide a privacy. Okay, so we have to provide a privacy with we have to put a screen and everything. Okay, then we have to wash our hands. Okay, wash your hands. After keeping the things ready, I'll wash my hands. Okay, just assume that I'm washing my hands. Okay, after my washing the hands, I'll wear a gloves. If I need, I'll wear a gloves. Otherwise, I don't want to wear a gloves. I won't wear it. Okay, so today class I don't want to wear a gloves. Okay, so if I'm giving a bath for unconscious patient, I have to give the eye care to the patient with the normal sun. Okay, patient with the unconscious, sometimes there is a sticky feelings will be that discharges will be there. So that case I have to use the normal saline to clean the eyes. Okay, you know the eye care. Okay, so if a patient is conscious, okay, patient is okay, just they have some orthopedic conditions, just they cannot go for anywhere from the bed. So that case we can wipe we can wipe with the towel with the face on the. Okay, so first we'll see about the we'll start the cleaning from head. Always the starting procedure, all the procedure, it should be start from the head to head and towards the food. Okay. So first we'll clean the face. Okay. So I'll put the towel. I'll put the Macintosh over the pillow to protect the pillow. Okay. Now I have mixed I have to pour the hot water. Then I have to pour the cold water. Then I have to check the temperature of the water. Okay. Sometimes some procedure they were telling inner aspect of the arm with back of usually we will see the more sensitive area. So we have to check the temperature of the water back of the hands. Okay. After checking, okay. So I have to start the pressure. Before that I have to do the method. You have to method the sponge flour. Okay. So you have to start from this. Okay, see. You have to give special care to the eyes also. Eyes and the ears. Okay. So like this way you have to do it. Then okay. Then you have to keep it. Better you use the trolley whenever you are giving a bath angle. This is not enough to accommodate. Okay, better use the trolley. Okay, so you have to. So I have to apply the soap. Then I have to clean this. If patient is conscious, we have to tell them to close the eyes. Okay. You have to clean it. Okay. After cleaning, you have to wipe the face. You have to wipe it. Okay. After wiping, okay. So always keep the patient near to you. Okay. Don't, if your patient is far away from you, you have to stay in more. Okay. So keep always you have to keep the patient near to you. Okay. So after that, we have to we should not unnecessarily we should not expose the patient. Okay. So we have to cover the patients. Okay. Okay. Next. Okay. First we will finish the furthest arm. Okay. This is whenever you are cleaning, you have to clean the furthest arm first. Okay. Place the towel to protect the bed. Okay. Furthest arm, the procedure we have to interlock the patient hand with our hand. Then we have to start from distal to proximal. We have to clean upper side, then sides and inner aspect. Last you have to clean the axilla and you have to clean. Okay. Next we have to apply the soap. So gently clean. The clean surface. Maxilla after cleaning. Okay. Then you have to dry the hands. Then you have to bring the towel. Same manner we have to repeat the procedures. Okay, like this way you have to clean sides, then inner aspect of the axilla. Okay. Clean the axilla. ஒரு போல் எடுத்துட்டு வா. சோப் கிளாத்துக்கு தலைமாலை வச்சுக்கிட்டோம். Okay, soap cloth you have to keep that separate bowl, you have to keep it in the bowl only. Okay, you should not place on the water. Okay, so dry cloth we can place it. Okay. After drying the patients, okay, you have to bring the can ask someone to help you. Okay, so keep the basin like this way. Keep it. Both hands we have to bring it. Turn the patients. Turn themselves. Careful. If one person is to be okay, you have to, both hands should be clean like this way. Then apply the soap. So you have to interlock your fingers with the patient. Inside the fingers, this thing you have to clean. Then okay. After that, you have to with clean towel. Both hands should be clean. Place the patient in proper position. Okay, discard the water. Discard the water in this. You have to discard the water in the bucket. Now after face under cleaning the hands, just I discard the water. Okay. Next, so again I am mixing the water. Okay. So now I am going to clean the chest and the abdomen. So should not expose the patient. So unnecessarily you should not expose the patient. Okay. So we have to fan fold the top linen. We have to fan fold. Okay. So whenever you are cleaning the chest, okay, for gents or ladies, those whomever it may be, unnecessarily we should not expose the patient. Okay. So you have to lift the patient towel like this way. Okay, you have to clean. Okay, so the cleaning should be done from the axillary line. Okay, so for the purpose I am doing that one, but you should not expose it. So you always you have to do like this. Okay, so axillary to up, only chest I'm not giving long stroke. Okay, so only up to the abdomen like this way we have to give. If ladies patient, breast should be taken under the breast, you have to take care of it. So apply the soap, same thing. So axillary line to okay. Straight line, okay, under the breast. Okay. After clean the chest. Okay. After cleaning, I am cleaning the abdomen. Okay. So abdomen. So only whichever the part we needed, that part should be exposure. Okay, same thing. So from this area to thoracic cavity to iliac. Okay, like this way. When you're coming to the umbilical, you have to do the rotating. You have to remove the like this way. You have to rotate and take it. So like this way. Then this same up to symphysis pubis. Okay. Umbilical finally. I have to dry with it. So after cleaning the chest and abdomen, I have to turn the patient. That's it. Okay. Keep your notebook down. Just bring up. So we have to turn the patient. Whenever you are turning the patient, we have to hold the shoulder and we have to flex the knee, and one hand should be shoulder, one hand should be in the thigh. Gently you have to hold the patient. We have to call the patient. If patient is okay, conscious, they can turn, let them turn. Okay. If they're not conscious, we have to get the help. Okay. So we have to remove the towel. I'll put the towel under the back. You come this side. So now I'm going to clean the chest. Okay. So So we are always we have to start from nape of the neck to sacrum. So same thing, gentle line from straight line. Nape of the neck to sacrum. This way. You have to clean. Now, so here I am not applying. I am not using the soap cloth. What I am doing? So I'll make both hands. I will take a soap. I will clean it this way. So with a circular motion, so I will apply the soap on the plate. Okay. So after applying, I have to do that effleurage, prestige, that backer. When I'm giving backer, I will tell. So we have to give the massage because back, sacrum and gluteal regions are prone to develop a bed sore. So always have to go like this way. You have to give gentle massage to the patient. Okay. So after that, remove the soap with the soap cloth. Same. Nape of the next to sack. So yeah, after that I have to dry the area. Powder with the okay. So after the procedure, we have to apply the powder over that. We have to give a gentle massage to the patient. Okay. Okay. So after the back cut, we have to turn the patient. Okay. Now I have to discard the water. Okay. After cleaning chest and abdomen, I have to discard the water. Here hot water. Each time you have to take the temperature of the water. Okay. Now immediately we should not go to private area. Okay. So we have to clean the leg. Finally only we have to give a female patient. We have to give the perineal care. With this, or the male patient, we have to with a separate sponge cloth. We have to clean their private area. If patient is permitted, if a conscious patient, they won't allow us. Okay, if patient is unconscious, we have to keep a perineal care. We can give then, or we can separate cloth. We have to clean the perineal after completing the leg only. So yeah. Next we will see the furthest leg. So yeah. So we place the towel to protect the bed. We have to make the patient to flex the knee. We have to support the knee. If someone is there, we can call them to. So if patient is conscious, we will tell them to flex the knee and let them keep their legs like this way. Okay, if no one is there, we have to hold it, or we will tell the patient someone to hold it. Okay. Here, same thing. Distal to proximus. Okay. Distal to proximus. First, you have to give one stroke up to from the distal part of the ankle to knee. Okay, sides. Okay, then from knee to thigh. Upper sides, inner aspect with the groin. You have to clean. Okay. Same thing. We have to apply the soap. Same thing. We have to clean the distal part. Okay. Again, apply the soap. To hold like this. Upper side, inner aspects to the groin. Groin need to take. Okay. We can bring one stroke also, no issues from the distal to full proximal. We can bring from ankle to thigh also, not issues. Okay, so long stroke we can bring it. Okay, so inner side. Okay, after cleaning, we have to wipe it. I didn't wash the feet, check it, I didn't wash it. Okay, next. Near arm, furthest arm, next near leg. Same manner, tell the patient to flex the knee. Okay. Apply the soap. Should be very careful whenever you're long time you are crushing, you are keeping the legs. Sometimes patient will have a DVT, deep vein thrombosis, okay, thrombosis may develop. So be very careful. Okay, should not make the patient to long time flex the knee. Develop a embolism. Should be very careful. Then take care of the groin. Okay. Then we have to wipe it. Okay. After cleaning the this thing, we have to clean the feet. Okay. So bring the basin. Okay. Put the patient leg on the basin. Make the patient to keep the legs on the water. Okay. Then you have to pour the water. Then how we have taken care of the fingernails. Same thing, you have to clean the patient feet also. Okay. To nicely clean. If you are doing it this way, patient nails will be wet. So easily you can give a nail care after this. Okay, patients, we are putting a water. So patient's feet is on the water. The nails become very soft. Easily we can give a nail care. Okay, nicely you have to give the thing. The unconscious patient legs are not like this way. Skin would have been peeled. So much infection. Nails will be big size. Okay, so nicely you have to clean like this way. Remove this. So with the towel we have to wipe it. Okay. So after cleaning, so we have to make the patient, we have to wear the dress. Okay. Then we have to comb the hair. Then we have to apply the powder and face powder for the face, and clear. Then we have to remove all the linens, okay, top linen. We have to change all the linens. We have to place a new linen, make the patient to be comfortable, okay. So after that we have to replace the all the articles, whatever things we use, it should be kept in the utility room, okay. That's all about the sponge bath, okay. You have any doubt? You got some idea, okay. So first you have to clean the face, then you have to clean the furthest arm, at the near arm, next chest, abdomen, then back, okay, then furthest leg, near leg, okay, then feet, sorry. After the chest and this thing, we have to give a back. We have to clean the back, then you have to go for the furthest leg, near leg, and the feet of the patient, okay. Then we have to change the dress and everything. That's all about the sponge bath, okay.
Thank you.